Hey everyone, it's Sarah here. In this first video, I'm going to present an overview as a whole to this chapter. My hope is that this video will help you focus your attention as you're reading and move through the homework as well. I really hope that you guys will have a solid understanding and foundation of the material by the end of these videos. This chapter is chapter 18, as you can see, in the second edition of the Sunheimer textbook, Clinical Laboratory Chemistry, Cardiac Function. As I previously said, this video is meant as just an introduction overview of the entire chapter. After I go through a brief overview of the chapter, we're going to talk about the objectives as well as the key terms and just again a brief introduction overview summary of the chapter as a whole. My goal here is to really help you guys figure out as you're reading to figure out where to focus your attention and emphasize the BOC applicable knowledge versus the bench applicable knowledge and where those two things meet as well. Hopefully you guys can compare and contrast each of those topics as well as you move through. So we're going to go ahead and jump around in the first two pages of the chapter. I want to go over the introduction of the chapter in a way that will really help you focus your attention and then what to pay attention to. So you guys can look at the what's ahead in this chapter. We're going to discuss the anatomy and function of the heart, describe the events leading to an acute coronary syndrome and cardiac dysfunction, discuss cardiac diseases, describe cardiac biomarkers used to evaluate our patients with heart-related problems, and identify assays that are used to measure cardiac biomarkers. Moving into our objectives. So now that we know a little brief overview of what to expect in this chapter, now we're going to go through the objectives. I highly recommend reading the objectives before and maybe even writing them down. If you're anything like me, when I take my notes, I write down the objectives and then I leave space under or next to so I can write some notes about what I notice in the chapter that hits those objectives that are listed. The objectives in any courses are meant to help you focus your attention to achieve some type of goal. So we have level 1 objectives and level 2 objectives within this book. Level 1, so following successful completion of this chapter, the learner will be able to explain inflammatory responses associated with atherosclerosis, define acute coronary syndrome, ACS, list 5 factors that defined an ideal cardiac biomarker, identify 2 biomarkers used to evaluate each of the following events associated with vascular inflammation, and then A through F within that inflammation. Define high sensitive or HSCRP relative to cardiac usefulness. Identify the clinical usefulness of the following cardiac biomarkers, and we'll discuss those deeper into the chapter. Discuss the advantages of point of care testing for cardiac biomarkers, and discuss the temporal relationship and concentration of the biomarkers in a patient with suspected acute myocardial infarction or AMI. In our level 2 objectives, level 2 essentially is hitting them a little bit different, higher level. So in our level 2, we're distinguishing between the biomarkers used for each of the stages shown below that leads to cardiovascular disease. And again, I'll let you guys read A through C. Explain the differences between CTNT and CTNI and include the function, specificity, and explain the difference between the two. Explain the difference between BNP and NT-proBNP and include the following: function and specificity. We will definitely again talk about all of these as we actually get into the chapter. Explain the principal cobalt of the cobalt binding assay or CBA used to measure IMA. Identify potential sources of interfaces, both analytically and physiologically, for the following biomarkers. Identify the limitations of the following biomarkers relative to various disease states. All right, so now we've gone through the what's ahead section of the textbook to get an overall understanding of what to expect throughout the chapter. Then we've gone through our objectives. Hopefully you've written them down or you have an understanding of how to take note of each of those. And then now we're going to go through the key terms. Understanding your key terms is extremely important when we talk about that BOC or Board of Certification. When you have a comprehensive understanding of those key terms, you will be able to actually dissect the questions to help you better understand that material. So the key terms for this chapter are going to be acute coronary syndrome or ACS, angiogenesis, arteriosclerosis, atherosclerosis, biomarker, coronary artery disease or CAD, cytokines, endothelium, ischemia, necrosis, risk factor, temporal, and troponin. All right, so now we've gone through all of those sections that I just listed. We're going to do an overall introduction of this chapter. So, what is our role as medical laboratory professionals for cardiac patients? So, the lab's role in cardiac health as clinical laboratory professionals, we play a critical role by providing diagnostic tests that aid clinicians in monitoring cardiac health, essentially. So we have biomarkers that help assess risk, stage disease, and guide proactive treatment. And then we have, throughout this chapter, a specific focus on those cardiac biomarkers, the key biochemical indicators for assessing cardiovascular dysfunction. So, despite there being a decline in cardiac related deaths, there are still a ton of Americans that still experience heart disease, making biomarkers essential tools and evaluating not only the disease progression, but then treatment response as well. So these topics are going to include the biomarkers and CVD process or cardiovascular disease process. We will learn how about the physical and chemical attributes of those biomarkers and then their clinical relevance. You'll see as we go through this chapter how some of those cardiac markers are utilized a lot, such as troponin, or some that aren't used as much as well. So biomarkers such as cytokines, high reactive C-reactive protein or hsCRP, and ischemia modified albumin IMA help keep track of said inflammation, plaque formation, and ischemia and cardiovascular disease or CVD. There is an inflammatory theory of atherosclerosis. So historically, it was viewed as a lipid storage disorder. Atherosclerosis is actually now understood to be influenced by inflammation. So this chapter is going to explore how the factors like oxidized LDL, hypertension, and infection contribute to acute coronary syndrome and atherosclerotic vascular disease, ASVD. I hope that this chapter overview intro video has helped you guys kind of focus your attention a little bit more of what to focus on during this chapter. And then the next video that I post is going to go over the case in point as well as the chapter review questions to further help you understand where to focus your attention as you go through the chapters as well as the chapter homework and the PowerPoints as well. If you have any questions, absolutely let me know at any moment. Definitely make sure that you include myself and Jed on any emails and let me know if you guys need anything else. Have a great day.